Good evening. I'm psychiatrist Jay Fauver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 27th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call here in the Fort Wayne area by dialing 969-2720, or if you're calling any place long distance, toll free, you may dial 866-969-2720. Now on a fairly regular basis, we are broadcasting live every Monday night from our spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at mattersofthemind, all one word, at WFWA.org. That's mattersofthemind at WFWA.org. And I'll start tonight's program with an email I just recently received. It reads, Dear Dr. Fauver, I just had surgery to remove one of my 4 parathyroid glands. Please explain how the parathyroid plays a role in mental health, and I'm looking forward to my extreme irritability being resolved. I have a good optimism there that it can be resolved as well. Your parathyroid glands, as you are aware, sit on the back of your thyroid gland here on your neck. So there are 4 little dots that are on the back of your thyroid gland. You had one of them removed because presumably it was pumping out too much parathyroid hormone. When there's excessive parathyroid hormone, the calcium gets sucked out of the bones and you get higher calcium levels in the body. For some weird reason, that causes more depression, more irritability, more difficulty with concentration and memory. And some people can actually lose touch with reality when they have all that calcium released like that. So if you remove one of the parathyroid glands, for instance, that's causing that particular problem, you'll notice typically within a month you have an improvement with the symptoms. That includes your irritability that you mentioned, but within a year often it dramatically does improve. Now sometimes we will give medications that maybe affect serotonin or even glutamate for that matter that will help with that irritability in the meantime, but that's considered the treatment of choice. If you have a high parathyroid gland activity that's increasing calcium release from the bones, that's what you do. You take it out, and within a month, over the course of a year, those symptoms should improve. Thanks for your email. Let's go to our first caller. Hello, Hannah. Welcome to Matters of the Mind. Well, Hannah, you wondered why ADHD medications are effective for some people, and what happens to your brain if you don't have ADHD and you take the medication anyway. Well, why does it calm some people down, and what effect does it have? Why does it have a different effect on other people? Hannah, basically with ADHD medications, they are for the purpose of correcting the decreased activity in the front part of the brain. So here's the front part of the brain looking at you. I cut it in half. So there's another half over here. So I took the brain apart and cut it in half. The front part of the brain helps you pay attention. So if you have decreased activity in the front part of the brain, you will have trouble focusing and concentrating and paying attention to things that aren't that interesting. A second aspect about ADHD will be this middle part of the brain called the arcuate fasciculus area that's connecting the front part of the brain to the hearing part of the brain can be disrupted, so you're not actually hearing and processing information so well. So when we talk about ADHD, we're talking about difficulty with attention span and focus, and we're also talking about difficulty with distractibility. What ADHD medication will do for people who have those problems will be to fire up the front part of the brain so it can help you concentrate and focus better, but it can also fire up this middle part of the brain that allows you to be able to pay attention and not be so distracted by outside different activities. So with that being said, ADHD medications can work well for people who have those symptoms. But what if you don't have ADHD, your focus is good, you're not highly distractible, and you take ADHD medications? You do it recreationally because you hear about your friend doing so well on this or that medication. While you take your friend's medication, what happens to you? Well, what you'll notice is you won't have any improvement with ADHD. As a matter of fact, you might have a worsening of the ADHD symptoms that your friend has and you don't. So if you don't have ADHD symptoms, it'll give you difficulty with racing thoughts, trouble with paying attention. In other words, it's kind of like wearing eyeglasses if you don't need them. Some people wear eyeglasses and it corrects their vision. Great. If you wear somebody else's eyeglasses and you don't need your vision corrected, your vision will probably be worse with the eyeglasses if you don't need them. That's what happens with ADHD medication. If your brain does not need that type of change in the neurochemistry of your brain, you'll probably notice that you get have a worsening difficulty with focus, concentration, and even more distractibility. Years ago, they did studies on people who had ADHD and who didn't have ADHD, and they gave them Ritalin. And they just kind of wanted to see how they did on Ritalin. The people with ADHD, how they do on Ritalin. People without ADHD, how they do on Ritalin. They gave them typing tests. And the people with ADHD did better on their typing tests, fewer errors, faster speed. If they took the Ritalin, they did better on their typing tests. If they didn't have ADHD and they took Ritalin, they were faster in their typing, but they made more errors. In other words, it makes you more hyped up, more energized if you take ADHD medications in the form of stimulants, but it will not help with concentration, focus, and distractibility. So for that reason, it's very important that we try to diagnose accurately if somebody has ADHD and give them the appropriate medication, just like we need to diagnose somebody accurately if they have poor eyesight. If you have poor eyesight, okay, let's correct the vision. But you're not going to just haphazardly give everybody medications or eyeglasses and any more than we give people medications unless we felt like we had specific issues they wanted to address. Hannah, thanks for your call. Let's go to our next caller. Hello, Anthony. Welcome to Matters of the Mind. Anthony, you wanted to know about the effects of COVID on brain activity. The COVID-19 virus, Anthony, was a virus that did directly attack the neurons in the brain. And you might have been aware that when people had COVID, they couldn't smell. And it wasn't because they had nasal congestion. It's because it actually affected the olfactory nerve right up front here. The olfactory nerve's in the front part of the brain. And it affected that nerve directly. So the reason you couldn't smell wasn't because you had nasal congestion, it's because you had nerve effects right in the brain itself. And what we have found over the course of the years in treating people who had COVID disturbances, many people had more irritability, poor focus, poor concentration. Many people, especially for the year after they had COVID, would tell us that they had this brain fog. They just couldn't process information as well. Some people had flat out highs and lows, which we called bipolar symptoms, manic depressive symptoms, or what they used to be called. But some people would have dramatic mood shifts after having the COVID virus itself. So the COVID virus will go directly to the nerve cells, and for some people would give them difficulty with that, anxiety, irritability, moodiness, concentration difficulties, and we would treat them symptomatically with medications that would fit the best. We often would look at it somewhat as a traumatic brain injury. When people have a traumatic brain injury, they have a concussion, they get a jarring of the brain, and many people have disturbances with this particular chemical called glutamate. So we'll often give patients who've had COVID a medication like lamotrigine or Lamictal that will specifically affect glutamate and try to stabilize that out. So there's a lot of different effects people had with the COVID infection on brain activity. For most of those people, thank goodness, after a year or two, it did diminish. So right now, we're not hearing about so many people having difficulty with COVID-related brain disturbances as we did 2 years ago, Anthony. Anthony, thanks for your call. Let's go to Jenny. Hello, Jenny. Welcome to Matters of the Mind.
Hi, Dr. Falver.
Hi, Jenny.
I just have a question about some medication. I just wondered if you could be on too much antidepressants, if it could work the opposite way, still make you have more issues.
The quick answer there, Jenny, is yes. If you take an excessive dosage of an antidepressant medication, it can give you side effects. And what we often hear about will be people have an emotional blunting. In other words, going higher and higher and higher on your dosage of an antidepressant doesn't make you feel happier and happier and happier. It's probably going to give you more side effects. And that especially goes for the medications that affect serotonin. If you take a medication like Lexapro, Celexa, Prozac, Paxil, Zoloft, and go higher and higher on the dosage, you'll get this emotional dulling where you don't feel happy, you don't feel sad, you just feel kind of blah. Bupropion, Wellbutrin, doesn't affect serotonin at all, but if you go higher and higher on that, you can feel hyped up and irritable and overly energized, not in a good way. Cymbalta, duloxetine, increases serotonin and norepinephrine. It's kind of a medication that could, at higher doses, give you some emotional dulling, but also, based on its norepinephrine effect, give you a fast heart rate. So the bottom line is, Jenny, we always want to look at that sweet spot for people. You want to find the dosage that really helps somebody for depression, but yet not excessively to the degree that they have side effects and they feel worse. So we're always assessing, okay, when we increase the dosage from here to here, did it make you feel better? If it didn't, we need to go back down to the lower dosage. So I'm always asking people, did you notice a difference when you increased this dosage from 30 milligrams to 60 milligrams? If you didn't, we need to go back down and kind of see if that 30 milligram dosage, for instance, is the sweet spot. Jenny, thanks for your call. Let's go to our next caller. Hello, Don. Welcome to Matters of the Mind. Don, you mentioned you recently had a ventricular peritoneal shunt. That's a shunt that goes from the middle part of your brain down to the abdominal area to relieve pressure from the brain. What are the mental health symptoms should you expect from relieving that pressure? By all means, John, you might notice that with that VP shunt to relieve all that extra fluid that's in the brain. That's what happens with a VP shunt. Your brain is not adequately draining off fluid. We got these little fluid-filled spaces in our brains called ventricles, and if they are excessive in fluid, the brain gets kind of pushed out a little bit, and you have difficulty sometimes with walking. Many people will have trouble with memory disturbances and concentration, and for some people it'll actually make them tired. So we'll hear about people that have normal pressure hydrocephalus. You might have heard about that in NPH. Normal pressure hydrocephalus is where you get this expansion of the ventricles with excessive fluid, and it pushes against the nerve cells and will give people difficulty with the concentration and many times even walking for that matter. So what might you notice over the course of 3 months to 6 months? Many people notice that they have an ability to walk better and they have the ability to concentrate and remember things better. But some people, especially as they get older, Don, they'll notice that they have trouble with their memory in such a way that it'll be due to the normal pressure hydrocephalus. They get that relieved with the shunt, and the memory can start to come back quite a bit. Don, thanks for your call. Let's go to the next caller. Hello, Jack. Welcome to Matters of the Mind. Jack, you want to know, why does high anxiety cause you to break out into sweats? Do you need to adjust your medication? Well, there's two factors going on there, Jack. On one hand, you bet, a lot of anxiety can give you excessive sweatiness. Some people will have social anxiety, and as a manifestation of their social anxiety, they'll get sweaty armpits and they'll get sweaty all over, and they just get sweaty when they get anxious and nervous. Other people, you mentioned medication, can be affected by medication because some of the antidepressant medications, especially the ones affecting norepinephrine and dopamine, to some degree serotonin, they can make you kind of sweaty itself. You bet. Talk to your clinician. If you're on any medications, just determine if there's any factors there associated with sweatiness and address it accordingly. But yeah, anxiety can sometimes make you kind of diaphoretic or sweaty as well. Thanks for your call. Let's go to our next caller. Hello, Addie. Welcome to Matters of the Mind. You go by Adeline, understand? It's Addie. Okay. Addie, you'd asked if there's a difference between self-harm behaviors and suicidal ideations. Well, self-harm behaviors are basically where a person gets really frustrated and gets irritable and tries to harm themselves. They might cut at themselves, they might do various things, they might punch themselves, and they might hurt themselves. And what they're trying to do is relieve the tension that is there. They're often, as strangely as it sounds, they're not trying to hurt them, they're not trying to kill themselves. So it's not a suicidal type of behavior, it's more a behavior just to relieve tension and relieve stress. For instance, when people cut at themselves, they release in the skin these opiates that are in the skin. And the opiates in the skin will go to the brain and give your brain a calming effect. It sounds weird that that would all work out, but some people will haphazardly cut at themselves and create this opiate flow to the brain, and in doing so, they will have a calming effect. So it's kind of a self-soothing effect to actually try to hurt themselves and have these self-harm behaviors. So when somebody is self-harming, often they will very openly say they're not trying to kill themselves. Oh no, they wouldn't even consider that. they're trying to relieve the tension and frustration they're experiencing at that time. And what we try to do in those cases, obviously, is give them coping mechanisms to try to deal with those type of behaviors, because obviously those aren't something that are considered to be normal, and we want to be able to help them cope in different ways. Sometimes going out for a brisk walk, playing with the dog, running, those type of things can relieve some of that tension in itself. Addie, thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Favre, since I started taking bupropion, that's also known as Wellbutrin, about a month ago, I've been clenching my teeth to the point where I now have severe TMJ-type pain in my jaws. Is this a side effect of bupropion? It's not as much of a side effect of bupropion as it would be from the serotonin medications. We hear about that all the time with the serotonin medications. I mentioned those before, Lexapro, Celexa, Zoloft, Prozac. The serotonin medications can give you, as a side effect, a tightening of the jaws, and it's called bruxism, and it's particularly problematic at night for a lot of people, and it can actually wear down your enamel. We hear it especially with the serotonin medications. So number one, if you're not on a serotonin medication and you're only on bupropion, and it only started when you started bupropion, okay, that could be from the bupropion. Not as common with bupropion or Wellbutrin, but it can happen, and it's usually dose-related. About 1 out of 4 people are slow metabolizers for the enzyme that metabolizes bupropion. You might be one of those 1 out of 4 people, so 150 milligrams of bupropion for you is more like 450 for a lot of other people. So you might need a lower than usual dosage of bupropion, but as I always tell people, when they're having problems that started up, I'll always ask, okay, when did they start, and what medication changes or what nutritional changes coincided with when those symptoms started? If you notice the symptoms started when you started bupropion, okay, it's probably likely due to the bupropion. We have over 20 different antidepressant medications that we can now use, so there's a lot of other options out there. Thanks for your email. Let's go to our next caller. Hello, John. Welcome to Matters of Mind. Well, John, you had a question about fish oil and antidepressant medications. Fish oil is something that was highly popular for the use with depression, probably about 20 years ago, John, the omega-3 fatty acids. And there were speculations that women in Japan had a 50 times less likelihood of having postpartum depression, thought to be due to their fish intake. So there's a lot of excitement about the whole idea about fish oil and helping the mood about 20 years ago. That excitement has since faded, such that it's now thought that the omega-3 fatty acids didn't have as big of an effect on medications as we thought. Now, can you take fish oil for your heart condition? Okay, fish oil appears to be effective for the heart. You can always talk to your primary care clinician or cardiologist about that. And if you take fish oil, I think your question is, it's not going to interact with the antidepressant medications. Fish oil and antidepressant medications play together in the same sandbox quite nicely, so you can use fish oil with antidepressant medications without any major interactions. But it's a good question because there are a lot of supplements out there that will interact with antidepressant medications. Many people will look at St. John's wort, for instance, as being a supplement that they want to add on. Well, St. John's wort can give you extremely high blood pressure and what's called serotonin toxicity with certain antidepressant medications, so we have to be careful about all those type of things. So when people are having difficulty with supplements added on to the antidepressant medications, we often want to get them off the supplements overall. Thanks for your call. Let's go to our next caller. Hello, Chris. Welcome to Matters of Mind. Chris, you had mentioned that you gained weight during the COVID shutdown. Are your feelings of low self-confidence and isolation currently normal? Chris, we heard a lot of people say they gained weight during the COVID pandemic. I saw some reports that it wasn't uncommon across the entire country for people to have gained 6 to 8 pounds during the 2.5 years of the COVID restrictions and the shutdowns that we had to endure. And a lot of people had trouble getting back out in public thereafter. If you already had some degree of social anxiety, coming out of the social anxiety was difficult for a lot of people because they had to kind of learn new social skills. And it was particularly problematic for children and adolescents because when you're a child and you're an adolescent, you're learning social skills. Here you had to wear a mask every day. You couldn't communicate people. You couldn't pick up social cues as you usually would like to do so. So we're hearing a lot of the after effect of the physical and the mental health consequences, unintended consequences of the COVID pandemic shutdown. And I'm hoping and thinking that in the future we'll probably handle that a bit differently, because there were way too many poor outcomes from the shutdown as they were. And I don't think it's any coincidence that the opiate epidemic for the United States drastically exploded during the shutdown restrictions, and suicide rate among young adults between ages of 18 and 24 tripled during the COVID pandemic shutdown. So this social isolation, lack of ability to communicate with other people adequately, increases the likelihood for depression. And we saw that happen across the entire country. The predictors for depression for many people will be social isolation, and the inability to really interact with people on a day-to-day basis as we ordinarily would. So that's why I'm always telling people, as they're recovering from a depressive episode, I'll tell them to try to interact and try to, even though they might not feel comfortable doing so, try to socialize with people and try to be outgoing and friendly to people in the community as a means of trying to get over the depression itself. Chris, thanks for your call. Let's go to our next caller. Hello, Jeanette. Welcome to Matters of the Mind. Jeanette, you wanted to know about the long-term effects of antipsychotic medications, and should your psychiatrist switch medications after a period of time? You don't have to switch medications after a period of time on antipsychotic medications, Jeanette, but what we do is we'll assess people with what's called an autonomic involuntary movement scale, an AIMS scale. And an AIMS scale is basically where we will methodically look at different movements and mouth movements, especially twitches in the eyes and shoulder movements. And in doing so, we try to determine, are there any long-term side effects occurring from the tight dopamine receptor blockade that can occur with some of the antipsychotic medications. Now, keep in mind, we have now 16 different antipsychotic medications, so we have a lot of different antipsychotic medications from which to choose. And in choosing them, well, some of them are tighter dopamine receptor blockers than others. Now, it doesn't mean they're going to work better or worse, but if you're on a tight dopamine receptor blocker and you're getting this twitchiness and you're getting these mouth movements going on, it's called tardive dyskinesia. Yeah, we have medications for tardive dyskinesia, but who wants to take a medication to relieve a side effect that was caused by another side effect? I mean, that's not what I'd want to do. So to try to avoid even getting that side effect, sometimes we wanted to go a different direction with something that's less tightly bound to dopamine. And that's the biggest long-term side effect. We used to be concerned about metabolic issues. We still are to some degree, but we have to remember that when people take antipsychotic medications, they're taking them for conditions like schizophrenia and bipolar disorder. Schizophrenia and bipolar disorder already have metabolic issues as part of the underlying condition themselves. So if you have schizophrenia or bipolar disorder, you're much more likely to develop type 2 diabetes compared to somebody who doesn't have schizophrenia or bipolar disorder. So we need to treat those conditions accordingly in hopes that we can, by successful treatment, decrease the likelihood of having metabolic conditions. But if you have weight gain associated with some of the medications, yeah, that can be a factor associated with type 2 diabetes, but probably a much larger factor will be the underlying condition that's being treated, and we need to treat that condition very, very effectively. Thanks for your call. Let's go to our next caller. Hello, Andy. Welcome to Matters of the Mind. Well, Andy, you had mentioned that you feel depressed when you're separated from your child, and during their visits with their other parent, you feel especially depressed. What are the steps that can help? What can change when they get older? Well, obviously, as the child gets older, Andy, you'll probably have less of that separation anxiety itself. Separation anxiety goes both ways. I mean, especially for women. Women will notice that that high level of oxytocin that's released upon delivery in the first few months of childbirth. That oxytocin, that bonding hormone, sky high. So women especially will have that mother bear instinct for several years early on. The child goes off to kindergarten, goes off to grade school. There's a gradual progression where they feel less overwhelmed with that child being away. Some of it is because it changes your identity. I mean, your identity as a parent is to be around that child. And if the child is becoming more emancipated, as we will often encourage in a healthy manner, that's a good thing, but it causes you to kind of change your identity and your role in day-to-day life. So that role needs to adapt to other types of activities than being a parent of the child in the household at that time. So when the child is with the other parent, that's always an issue when there's a split relationship with parents, and that's something that can be sometimes addressed with counseling. The best thing you can do for the child is to have a good relationship with the other parent. The last thing that child needs to pick up is any tension between you and the other parent. That's not healthy for the child, and it's going to affect your child's relationships later on overall. So will that separation anxiety as a young parent get better as you get older and as they get older? Yeah, that should happen, so that when the child becomes an adolescent and then a young adult, they become more independent. That means you've done a good job if they are able to develop healthy relationships thereafter. Andy, thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions concerning mental health issues that I can answer on the air, you may write me via the internet at mattersofthemind@wfwa.org. I'm psychiatrist Jay Favre, and you've been watching Matters of the Mind, now available on YouTube. God willing and PBS willing, I'll be back next week. Thanks for watching. Good night.
The preceding program on PBS Fort Wayne was made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.